We're going to have questions and answer time at the end. If you're managed to hold on the whole 2 hours and you do have any questions that I don't cover, I can certainly answer them at the end. Just for reiteration purposes, this is the EMR session of our Denali upgrade. We do have 4 sessions going on. 2 of those cover the billing module. We also have a 4th session that covers the portals. Today we're going to look at the EMR, which would be the clinical aspects of the upgrade. Now, some of the changes are going to be of an aesthetic nature, not really impacting the functionality. There are a couple of changes, however, primarily the orders management, which is going to be the bulk of the session, that has greatly been enhanced. So we're probably going to spend about 45 minutes to an hour discussing that particular piece. Getting started, though, we're going to look first of all at the general changes to the user interface, starting with the home page when you initially log in. And this would be applicable both to the appointment as well as the open encounter tabs of your home page. The columns have been resequenced. So if you see in the diagram here, we've kind of divided the columns into appointment level details and patient routing details. Now, there's nothing new as far as the present here, except there in the middle, you see we've added the encounter type. The encounter type previously was on a tooltip, so you had to hover your mouse over to find out what the encounter type is. So we have added that now as a static field on the home page. And to accommodate them, we have resequenced these so that they map out to all of the appointment level details there on the left-hand side, and then the routing details on the right-hand side. And the 2 screens now, again, are in comparison. They're the same. So your hand-eye coordination, when you're going between the 2 tabs, the data is going to be in the same sequence, so you don't have to adjust what you're looking at. Now, along with that, we have done a couple of changes to the labeling. Now, this is a label change only, so the underlying functionality remains the same, but under the visit status, where you previously saw nurse, right now today you see for nurse or ready for nurse or with RN. That has now been changed more generically to clinical staff. This is just in keeping with the fact that not every practice has nurses, and some of you who have clinical access under that profile don't really want to be considered a nurse in the patient routing. So in order to allow for that broader application of the clinical staff designation, we have removed the hard-coded verbiage of nurse, which was there from the very beginning, 15, 20 years ago, and it is now just going to be more generically saying clinical staff. Another small change under the patient register is with regards to the label for guarantor. Currently, it is known as responsible person. On the billing side, for those of you who use both practice management and EMR, we already call it guarantor on the billing side. So now, for consistency's sake, we have relabeled it guarantor in EMR. Also, if you notice above the patient photograph, the patient note icon, the color coding has been applied so that when patient notes are present, the color shows in the bright orange to catch your attention so that you know there is data present. Another change added here under patient register, and this would only be of use to those of you who do use practice management, under the billing info tab, there is a hyperlink now to the patient's current statement. So if you are an EMR only client, this would not be applicable, but if you use billing, the most recently generated statement for your patient will be available for you through patient register, even for your EMR staff who do not have billing access. So if the patient wants to discuss their statement, you will be able to open up the statement and discuss it with them. Another change with regards to the patient register, and this is when you are accessing it through one of the shortcuts. when you go through the menu tab, patient register, you have full functionality. But sometimes when you get to it through a pop-up, such as on the schedule page, down in the lower left where you have the name hyperlink and your patient info pane, or on the home page where you have the icon and patient details opens up in a pop-up, you don't have the full functionality, such as patient insurance. So that has now been added. The umbrella icon, so that when you are accessing patient register, no matter from where you access it, you are going to be able to do the patient insurance now. Moving to the appointment schedule, a couple of aesthetic changes on the new appointment window. The appointment history, currently it shows as a button with the label history. It has been removed as a button, relocated as the rewind button or icon. That rewind icon has already been in existence on other screens to open appointment history. So this is just to make it consistent at this level. Also a label change on the button that's existing right now. It's called cancel. It has been labeled change to close. That again is a label change only, just to prevent confusion. Some folks thought that that was how they were going to cancel an appointment, when in fact it was only canceling the modifications made to that window. So closing the window undoes the changes that had been made, and that is why we've made that change now. Canceling the appointment is done through another mechanism. Okay, so now we're going to get into the orders management, and this again is the primary feature change in the Denali upgrade. This is completely redone the way orders are going to be done, lab and radiology, but also bringing in consults and procedures. So this is an existing functionality known as the order sheet that has been enhanced. Many of you, though, depending on who implemented you and when you implemented and what types of orders you do in your practice, have probably never seen the order sheet because up until now, it really only accommodated lab and radiology. So it wasn't a full mechanism for all of your orders. But now we have added the consults and procedures as well as a combination of all order types. So we are now reintroducing the order sheet. So those of you who have been using it, this is an enhancement for you. Those of you who have never used it, you can think of it as a new feature. Starting with accessing the orders management, there are two ways to do the order sheet. One at the encounter level. You see there in the upper right, there is a table of content option on your encounter menu called order sheet. Again, some of you may already have it, some of you may not have it yet. You also can have this at the diagnosis level on your assessment. And this is by means of those little gray buttons. If you notice here at the bottom of my screen, if you have those little gray buttons on your ICD tab of the assessment, those are tied into the order sheet. In your existing version, you have 5 buttons: the RX, lab, radiology, consult, and procedure. In the upgraded version, you still have prescription, which is independent, and then the order sheet, which combines the other 4 order types into a single button. If you're not going to use the order sheet in your practice and you don't want to see these buttons, they can be hidden. So that property that you see there at the bottom will conceal these buttons so that you don't see them at all. For those of you who are not currently using the order sheet and you decide you want to use it after the upgrade, that property can be modified to display the buttons. You do not need the buttons in order to use the order sheet. This is just in order to do it at a diagnosis level. You will always be able to do it at the encounter level whether or not you have it enabled here at the diagnosis level. So that would be determined by the doctor's preference and workflow. There's also some user permissions associated with using order sheet. At the encounter level, those of you who have the administrative access to go under configuration and assign user permissions, there is at a role level the order sheet on patient encounter, as well as the various order choices under CPOE. CPOE, of course, stands for Computerized Provider Order Entry. So not only do you have the order sheet mechanism itself as an option on your encounter level, but you also have the individual order choices under CPOE for lab, radiology, consult, and procedure. And then if you also need to be able to manipulate the underlying master files, that requires configuration level permissions for those master files also. And as you see here at the bottom, there are new master files to go along with the consult and procedure workflows. Now getting into the order sheet itself, we're going to first look at the user interface, the comparison of the existing one to the new one for those of you who do already use it. Then we're going to look at the actual workflows with regards to how the order sheet is populated and the different processes of it. So what you're looking at here is the new user interface with regards to the Denali presentation of it. When you choose the menu choice order sheet from your encounter, and this is encounter level, by the way, so it does require the patient to have an open encounter. It opens in expanded view, so the screen real estate will be the entire width of the screen that you're looking at, meaning your menu, the table of content menu along the left-hand side will be hidden, and you will have that TOC toggle switch. So if you see the number 1 here on my screen, in the upper left of your encounter screen where your table of content menu is, it will be replaced with these 3 little triangles if you want to go back to standard view. The purpose of this user interface is to track all orders at an encounter level, both current and future as well as past. But again, this is going to be with regards to the patient level and or encounter level, but I'm going to give a caveat there when I say past, because when we look at our test selection, you're going to be able to see the last time that test was done and access those results. So even though we may be doing it now or for the future, you will be able to access the last time you did it in conjunction with the current encounter. And that is how it becomes a complete orders management tool for you at the patient level. We have all order types in one screen, lab, radiology, consult, procedures, and a combined quick view. So you can either look at them individually by order type, or you can go to the quick view and look at all of them in a big scrollable screen. So that again is going to be based on your preference. And this is based on a new accordion design user interface. So the right-hand side of our screen is going to be collapsible and expandable in this accordion format. Now, in comparison to the old user interface, for those of you who already have it, you see here that it is a single screen. And the table of content is displayed. It also is in kind of a static single tabular view, so you don't have the accordion where everything is presented all at once, so the functionality is a little more limited to you. So the new design gives us additional flexibility as well as increased functionality. Also, in the existing version, a lot of the process was external to this screen, so you had to navigate to different independent windows to complete the process. Whereas in the new UI, you will be able to complete everything in the same window. Now, speaking of that workflow on the order sheet, there are 2 specific workflows. There is a 2-person workflow and a 1-person workflow. This, of course, will vary from one practice to another based on how you do things and based on your doctor's preferences and whether the orders are going to be done in-house, scheduled for the future, etc. So as we get through the user interface and get into the workflows, we're going to see that there is a Save button and a Create Order button. And this is what will be determined by whether it's a single or a 2-person workflow. For instance, if you use the Save button, this is going to be a 2-person process. Typically, this is in a scenario where the doctor, such as in a busier type practice, where the physician doesn't want to be concerned with the administrative aspects. He doesn't care based on insurance what vendor the patient needs to go to. He just wants to say, do this lab, do this radiology, go to his next patient, and then let the MA or the RN come in and worry about it at checkout. So in that case, the doctor's going to use the order sheet just to tick off the tests he wants, go to the next patient. So he will save the tests he wants so that the nurse or the MA can come in behind and complete the order. That would be the two-person process in conjunction with the save button. In the create order button sequence, the single person, be it the doctor or the clinician, can do everything in one step. They're going to select the test as well as the vendor, as well as the diagnoses, go ahead and complete the requisition, print it or email it or fax it, whatever the scenario is. That also allows you to go ahead and enter your results immediately. So if you're doing it in-house, for instance, then you can go ahead and click the create order so that you can immediately post the results. So those of you who are doing in-house UAs or drug screenings and you want to go ahead and complete the entire process on today's encounter, you can certainly do that as well through the order sheet. So this is, again, going to be based on your workflow and what works in your practice. When it comes to creating the order on the order sheet, and we're going to dissect this user interface. It's kind of in three sections, but to create the order, we have our left-hand side, which is the Select tab. This is where you search through the tests for each category and you select them. And as you select the test on your left, it goes over to the right, which is where you're going to then complete the order. Verify you've got the right diagnoses, the right vendor, and then complete the requisition and produce it. And again, if you use the Save button, it's going to require a second person to come in behind. If you notice in the lower left, there's a blue bubble here. In conjunction with the two-person workflow, there's a property that updates the status on your home page so that your clinicians know what tests need to be done. It will update that status on the patient routing. Instead of saying with doctor, ready for nurse, it will say process consult, process lab, process radiology. And then you can go into the order sheet and see specifically the test that the doctor has requested. In the case of actually clicking the create button instead of the save button, however, it immediately creates the order. So the status will go to approved and you can immediately create the requisition, hand it to your patient, fax it or email it or whatever the scenario. That immediately assigns an order number, makes it applicable for putting results on it. And again, we're doing all of this right here on the same screen. So that was just a summary or the overview of creating the order in the single person or dual person workflow. Now we're going to break it out and dissect the screen from top to bottom, left to right. So the top portion of the order sheet is called the orders ribbon. And this is where you're going to see tabs for each order based on the order type. And that tab is going to also give the schedule status. So each little tab that displays in this upper area in the orders ribbon where you see the number 1, it's going to be color-coded, and it's also going to have nomenclature that visually, in this one glance, will let you know the vendor, whether it's going to be done today on today's encounter, or if you scheduled it at some point in the future, is it a consult, a lab, a radiology, etc. So there's a lot of information packed into that one little tab. It will also let you know whether it's pending, or if it's already been created. It will also let you know if the requisition has actually been generated and gone out the door yet. On the lower left of the orders ribbon then, we have the select order tabs. This is where you're going to actually search and select your test and compose your order based on each order type again. On the right-hand side then, in our accordion screen, we have our selected list and orders. Within this accordion, by order type, you can expand and collapse each category and analyze and modify the order details and monitor the status. So you can see whether they're pending, completed, results received, is the diagnosis present or not, is it going to the right vendor or not, is it the right test or not, and so on. And then at the very lower right, you have your action buttons where you're going to actually compile and generate the order. So what you're looking at here is an empty screen by default. When you first have a patient arrived, you go to the order sheet, nothing's been ordered yet, so your orders ribbon is empty. You have nothing on the right-hand side, so all of your tabs display collapse with no details. On the left-hand side, however, you do see that there are tests already there by default, and we're going to expand upon that in just a moment. So again, starting with that orders ribbon and breaking it down now. An empty ribbon indicates there's no orders yet for that encounter, so it's just going to be a big empty space. When tabs exist, they're going to be color-coded, and the presence of data on each of those tabs in conjunction with the color is what's going to give you the visualization of what's going on with that order. Each tab will start off in the left-hand side, in the left-hand margin, with an indicator and a circle. That indicator is going to tell you the type of order it is. L for lab, R for radiology, C for consult, and P for procedure. If there is also a check mark, which is not included on this screen capture, that means the order is actually completed. That means you generated the requisition and it has been sent, either printed, hard copy, or electronically generated. So there'd be a little check mark next to the indicator for that. In this scenario where we don't see the check mark yet, that means our requisitions have not yet been produced. Now the title of the tab is going to be different based upon the status of the order and the color of the tab. It is going to either indicate the vendor in the case of lab and radiology, or is going to indicate the name of the consultation that is being requested, or the name of the procedure that is going to be ordered. That's while it is pending. Now once the order gets generated, those details get overwritten with the order number. That order number is based on a property that is locally defined. So you see the property there at the bottom of the page where you determine the type of prefix you want. By default, labs, for instance, will be LAB, radiology, RAD, consult, CON, procedure, PRO. But if you would like to change that, you have the ability of manipulating that property accordingly. Then there's a status indicator in parentheses. An N means now, meaning you're going to do it on today's visit, the current encounter. Or there will be a time increment, meaning it's in the future. W for week, D for day. So 1 week, 1 day, 2 weeks, 2 days, etc. Then the tab color is going to indicate in conjunction with its status. For instance, if it's pending or to be ordered, it will be light purple. If it's already been ordered, it will be dark purple. And if it is currently selected, meaning the one you're looking at, the one you're working on, it will be orange. So basically, if you're not looking at anything yet, when you just open your order sheet and you haven't yet selected an order, all you will see is light purple and dark purple, depending on if they're pending or ordered yet. And as soon as you choose one, that one becomes the one in focus and will display in orange. If the order has not yet been created, so in the case of the lavender or the light purple, there's also an X. The X will allow you to delete it if you have not yet created the order. Now, once an order's been created, you cannot delete it at this level. We'll show you how to delete that a little bit later. So this comes in handy again at the 2-level workflow maybe. Maybe the doctor had made some choices and now the MA or the nurse is coming in and verifying and he really didn't intend that. Maybe he ordered a left view, a right view, and a bilateral, and really all he needs is the bilateral. So you want to get rid of the others or whatever the scenario. So you have that ability here at your disposal before you ever process things. Following your eyes across the screen then, on the far right, underneath the orders ribbon, you have the order set icon. Now, order set is a master file. So you always have the ability of going into your order set under configuration to create them, but this gives you the ability in conjunction with an order sheet to create them ad hoc as you go. And the beauty of an order sheet order set is that they can be any combination of those tests. For instance, if you go under the order sheet order set master, you might want to create an order set of labs or an order set of radiologies, where, you know, there's a certain regimen where you're ordering 3 or 4 labs over and over again based on a condition, a protocol or something. Well, this is taking that one step further, where based on a certain scenario, you want certain labs and radiologies and consults and procedures. So you can create an order set at an order sheet level. So not only would it apply for that one patient, but it also lets you update your master file at the same time by clicking that icon. So that's your orders ribbon. Now going down on the left-hand side of the order sheet, we have 2 tabs. We're first of all going to look here at the Select tab. The Select tab is where you are going to choose the details for your order, your tests, as well as your parameters for those tests. So under our Select tab of the order sheet, if you see it outlined there in the blue square, this is still order sheet level. At the order ribbon level, we're going to now select, and underneath our Selection tab, we now have our different categories of lab, radiology, consult, procedure, or all of them combined into quick. So the selection process still breaks it down further at the category level. Now, if you notice the part in green, this is where I alluded to a little bit ago, that even though we're talking about a present or a future order, you can view past details for your labs and radiologies. So on the test that exists in your database, the screen is pre-populated, as you see here in the lower left, with codes that you have defined as your preferred or your frequently used. If those have already been ordered and or resulted, then that will show here, as you see outlined in green, with the last time you ordered it and or the last time you resulted it, and the icon is going to indicate whether that was an order or a result. So if it's an O, that means it was ordered but no results have come in yet. If it's an R, then that means that was resulted. And you'll notice the date is a hyperlink. So before you ever order it again, if you want to go in and review the results, you have that ability, because it might make your decision on whether you're going to reorder this test or order an alternate test. And as with all of our lab results, you can look at the matrix to see how things have fluctuated and changed. So it gives you a lot of detail right here in one screen without having to go and look under review matrix or something to get that data. So all of that is pre-populated by default just by choosing your order sheet option. Now, based on the selected tab, meaning the order type you choose, the parameters are going to be different. And then whatever you choose here on the left and you put it over on the right is what's then going to be compiled and either saved or created through the action buttons. So the Select tab in your existing world right now, when you go in and order a lab or a radiology, is when you click the little plus sign and then you get a pop-up and you have preferred tests, or you click the little book icon and you get all tests and you search for the test you want, and then it comes into your order screen. Well, you don't have to do all of those extra clicks anymore because they're pre-populated here. On the right-hand side then is the order selection details based on what you just chose on the left. And this is where you're going to be able to manage your orders, verify the data before you generate them, and then track it. Because this is also going to give you the status. It's going to let you know specifically the vendor, the doctor you referred the patient to on a consult basis. If it's a procedure, it lets you know whether it was in-house or external, so on and so forth. So you get a lot of information on this slide as well. The tabs, if collapsed, will have the little triangle, so you can expand or collapse it. When there's a test present, you'll have the little blue folder with the check mark. So visually, you'll know whether or not you need to worry about expanding that tab. If there's comments associated with the lab or radiology order, you can view those directly here from the order sheet without having to look up each individual order. You also have the ability here of changing the test. So again, now we're dealing now in the scenario where the doctor did not create the order yet. So there's no order number yet. This is the only time you can change the test. So for instance, I've got the abdomen series x-ray highlighted. Notice there's a little X beside it. So at this point, you could still change it if it was intended to be an MRI instead of an x-ray or something. Now, if you had already clicked the create order, then you would have an order number beside that instead of the X, and you would not be able to remove it. You would have to delete the order and create a new one. So at this point, you're able to modify the order since it hasn't been generated yet. That's another benefit of this design. And the two-person process, or even in the one-person process, the ability of saving instead of creating the order. Schedule options then. You see here, like for our lab and radiology, you have now or future. You can actually order both now and future. So if you want to go ahead and do it now, but then again in a week, you can do it all at one time here on the order sheet. And it will create two order entries in the system. One to go ahead and complete now, and then one to give the patient the requisition to have done in a week or whatever your scenario is. You've got the status indicator. Now, if it's pending, you will not see a status. So you're not going to see the status pending. There will be just nothing present beside the test name. But once it's been approved or ordered or results received, or if you've deleted it, you will see the status as you see pictured here. It'll either be in green if it's a valid order, or if you've deleted it, it's red. So when you mark it deleted, we don't actually erase it from the system. It still displays and is part of your audit trail, but it does indicate that you deleted it. So you'll see it in red at that point. Now you have two options for ICD assignment. You have an ICD hyperlink. You also have an assign ICD button. Now the difference, if you see in the screen design, and we'll get to this in a little bit later in detail, the ICD link is one test only. The assign ICD button is at a category level. So you may have multiple tests within that category. And then when we get to our procedure tab at the bottom, you have a little icon that indicates through the direction of the arrow whether it is an internal procedure that you're doing in-house or it's an external procedure where you're referring the patient to an outside provider to have that procedure done. So all these details and indicators give you all of this information in one glance on this one screen. Whether it's through an icon or the color coding, you get all of that information in one glance. Left-hand side, you're choosing the test. Right-hand side, you're qualifying it, assigning the diagnosis, the vendor, and then completing it. Now, when it comes to defining the diagnoses here at the order sheet level, you'll notice at the bottom of my slide there is a property referenced in blue. Now this is a long time existing property, so this part is not new to the upgrade, but it's relevant to what we're covering on this slide, which is why I've included it. Based on workflow within your practice, if you have diagnoses auto-populating out of a patient's medical history when their encounter gets marked arrived, then you will have diagnoses listed here already by default. So this Add ICD button that you see on my screen here next to the blue number 2, and then next to that you see all these ICD-10 codes next to my blue number 1, those diagnoses are displayed in 2 colors. It might be a little difficult to see on the PowerPoint. The first 4 diagnoses are showing up in a dark cyan blue color, and then the last 3 diagnoses are in an olive green color. The difference is that the cyan blue are assessment diagnoses. The olive green are non-assessment ICDs. This is all going to vary at one practice to another based on whether or not you use this property to auto-populate diagnoses on your assessment or not. The Add ICD button then is available to allow you to select or add ICDs to the encounter as well as to the order sheet. So again, workflow dictates. Some doctors may decide to do the orders before the assessment. Others may like to do the assessment before their orders. It all depends on how you do things as to whether or not your diagnoses exist yet. So this accommodates either or. So if you're doing your order before you have assessed your diagnoses on the encounter, you have the Add ICD button. So you can go ahead and choose the diagnoses that support these tests you're ordering. It will also go ahead and add them to your assessment at the same time. Or if you've already added it to your assessment, then they can default here. So clicking the Add ICD button gives you this pop-up, which is the general IMO search that you get now when you click your little plus sign to do a diagnosis search, or past ICD is this patient's past medical history diagnoses on their face sheet, which is the same as clicking the little H button on your assessment screen now. You'll notice number 3 here. If you hover your mouse over those diagnoses, it does give you the full description. So it will give you the breakout. Since we're only displaying by default the ICD-10 code, most of us have not yet committed to memory the ICD-10s. I know I still remember ICD-9s, but I haven't learned any ICD-10s yet. So if you want to know what they are so that you can validate in your brain, do you want to keep that diagnosis or not, if you hover your mouse over, it does display the description of all those codes, and then you can determine if you want to get rid of it or keep it. So that again is all right here on your selection piece before you've started compiling your order. Now there is a new property. Now, this property is new to the Denali upgrade, specifically for orders management. So this one up here is long-standing and has nothing, is independent of order sheet. This is specific to order sheet now. So you can decide the rule based on whether or not those diagnoses in that last property I just referred to is on or not, if you want those to automatically come into your order sheet based on these different options. So this new property under order sheet assign ICD rule, you can say all assessment ICDs will auto-assign, or non-assessment ICDs will auto-assign, only the primary will auto-assign, both assessment and non-assessment will auto-assign, or nothing will auto-assign. So this works in conjunction with this property. So if you are already auto-populating your assessment from past medical history when your encounters get arrived, then this is going to work in conjunction with that. Based on all of those that have pre-populated assessment, do you now want those to also default automatically to your order sheet? Now I mentioned that there's 2 ways over on the test detail side to assign diagnoses. So if all of the above is blank, you don't have anything defaulting, you've got the property set to not auto-populate, so now you want to manually assign diagnoses, you have the choice either number 1, which is at your category level, you have the Assign ICD button, or number 2, at a test level, you have a hyperlink. Both of these open the ICD mapping screens that you see here at the bottom of my slide. The only difference, you'll see the one on the right has a second panel or a column that lists all of the tests within that section. So on the left-hand side of my slide, when you are clicking the hyperlink, that is specific to that test only. And you can decide which diagnoses you want on this order for that test. When you do the Assign ICD button at the category level, you choose the test within the category as well as the diagnoses. And you've got the same color coding here. If you notice, my list of diagnoses are exactly the same. It's just a matter of whether or not on the right-hand side, I've got all 3 x-rays that I have added to my radiology order sheet. So I can decide which ones I want to go to the bone density, which ones to the x-ray, which ones to the pelvis. Whereas on the left-hand side, I have chosen the bone density only. So that again is all going to play into your workflow preferences as well as all of the above properties we just talked through as to whether you have things pre-populating or if you're going to choose them as you go. Then we have the action buttons at the very bottom. Reset, of course, undoes anything you haven't saved yet. That's always a safe bet. If you've been playing or you made mistakes, found out you're on the wrong patient, just hit reset. Save is going to take what you've just been working on above and add it to your orders ribbon as a light purple button. Up until this point, you don't have any tabs, of course, on your orders ribbon yet because you've just been working down below, choosing your tests, choosing your vendor, assigning your diagnoses. So now you got to decide, am I going to save this so that another person can come behind me and complete it, or am I going to go ahead and create the order all myself? So if you click Save, it's going to add a light purple button or tab to your ribbon. And as you see here in my number 2 bullet point, I ordered a procedure called audiometry for 1 week from now. So the light purple has a P indicator in a circle. It's called audiometry, and it says 1W for 1 week. I haven't completed it yet, so I have the little X, which means I could remove it before I end up leaving my order sheet. At this point, the status is approved or to be ordered, so that if I'm the doctor doing this, I can now leave my order sheet and go to my next patient, and that's updating my homepage status so my nurse now sees I need a procedure completed, and then she can go into the room and complete the requisition for me, if that's my workflow. Or number 3, I can click the Create Order button. Create Order is going to put it on the orders ribbon as a dark purple instead of light purple. And instead of showing me the vendor or the schedule date, it gives me the order number. So in my number 3 bullet here, I've used lab as an example, and it's given me my lab order number 00140. Based on the property, again, that is user definable, but what you see here is the default in your upgrade. LAB is the prefix for lab. So you're either going to create it immediately, which you can then print, fax, or e-send based on how you process labs. Alrighty, so that is the user interface coming down top to bottom through the ribbon and the different panels. Now the workflow to compose the order. On the Select Lab Radiology side, and I mentioned now this screen, even though it looks the same, has different behaviors based on the order type you're working with. So lab and radiology and our webinar we take together. Lab and radiology behave exactly the same. The only difference is whether it's blood and urine work versus X-ray and nuclear work, and X-rays and MRIs and scans and whatnot. The vendor is going to give you a pick list that displays all of the applicable vendors out of your master file based on the order type you've chosen. So in composing your order, again, just like now when you're on your encounter and you go to lab order or radiology order, you choose your vendor. And then you're going to click your little plus sign, which brings you a pop-up that defaults to preferred tests, or you click the book icon to go to all tests. The emulation here is you still have to choose your vendor, so that part has not changed from what you do now. The part that has changed, however, is your preferred tests are automatically pre-populated. So you don't have to click the plus sign to see those. You do have the option, however, if you notice here, between my number 1 and my number 2, it's defaulted to preferred, but you also have all, you have health maintenance, and you have order set choices. So we've expanded your filtering. And underneath that, you have the ability of filtering by, and if you follow the blue arrow to the right-hand side of my slide, you can filter now by panels only, by specific test names only, by categories, or by LOINC codes if you use those. So the filtering and searchability is greatly enhanced now as well. By default, your preferreds will auto-populate, so that reduces your search time. But if you do want to search, you have these other choices available. Now for the health maintenance choices, these are of course tied into your patient's face sheet. There's a property mentioned there in my bullet point number 4. In case you're not aware, that also is a long time existing property, not new to the upgrade, but that's what is based on whether or not your test would be filtered here. So if you choose to filter, if you do health maintenance in your practice, and you're wanting to order only the labs that are due for this patient on your health maintenance, that is what is going to govern it. It's going to be based on the health maintenance on your patient's face sheet, which is fed from that property. If you have lab order sets predefined, now this order set is lab only or radiology only. So a little bit ago when I was on the quick lab or the quick tab, I talked about order sheet level order sets, which could be all inclusive. This is not that. This is lab only or radiology only. So once you've chosen the test you want there based on all of those filterings, you choose it by clicking the little greater than arrow. That'll highlight. Now, my PowerPoint is saying pale green. I just want to give you a disclaimer. I actually was on site last week going live with the client, and on their computers, it was yellow. So I don't know if I have an issue with my computer resolution or what, because programming says it's supposed to be yellow, but for me, as you see in my PowerPoint, it's lime green. So I'm just going to give you a disclaimer. It's either going to be a pale green or a yellow color, but it will highlight in one of those citrusy colors for you to indicate the one you've chosen. And it will populate over on the right under the appropriate tab. That tab will then expand to display your details and give you the opportunity of verifying or assigning diagnoses as well as scheduling it. So if you notice above my number 5 blue bubble, the group type follow-up days period is utilized for when you're scheduling it in the future. That is the same group type that predefines your follow-up periods on your assessment or encounter close. When you stipulate that you want to see the patient again in a week or a month, it's the same group type. So you do have the ability of modifying that if you need to by going into that group type. You also, as you see number 4, have the ability of entering your comments if you use those. So you search based on however the tests are going to be filtered to your liking. You choose it by clicking the icon. It highlights in the citrus color, populates over on the right. You verify the details. That's for your lab and radiology. Now moving to the consult. Screen looks the same. Behaviorally, though, it's a little different. The vendor pick list is grayed out. It is disabled because there is no vendor master for consults. There's also no preferred list for consults, so it defaults to all, but notice it is still pre-populated. So you do not have to search for your consults because they will pre-populate. This is based on a master file. You'll notice at the bottom, now this master file has always existed. A lot of you never used it, however, because again, consults really weren't integrated into orders management. So a lot of you who are an existing client have probably never set it up before. And it has been modified with our upgrade, so there's new fields in it. You can now define your consults, which we'll talk about a little bit later, a little more specific to your needs. So this will predefine or pre-populate with all of the consults that you have set up. And if you notice here behind my number 6, you can have a default provider, or if not, you have the ability of assigning a provider to whom you're going to refer the patient for that consult. You have the ability of filtering these consults by specialty or by consult name. So for those of you, like maybe your family practice or internal medicine, and you refer to a wide array of different specialists, and so you have dozens and dozens, again, like where I was last week, they had hundreds of consults here. So this filtering was very useful to filter specifically to whom they wanted to refer the patient to. And then on the right-hand side, notice that it populates a little differently than our lab order did. Consults, obviously, are not going to be done in-house, so you don't have the option of doing it now, as we did on our lab and radiology. Consult is always going to be referred out, so your choices are to assign your provider to whom you're referring the patient. If the one on the left-hand side that defaulted from your master file is not who you want, as you see by my number 3, you can change it. So you can do a search of your master files If you notice at the bottom of my slide, we do have a new master file with the upgrade called Organization Providers. Previously, in your existing version, you had referring doctors only. And sometimes you don't want to refer the patient to an individual human, but maybe to a health center or a diagnostic plaza or something, and you don't know what human they're going to see. So you have the ability now of creating those types of entities under Organization Providers. So next to the number 3, you have a magnifying glass that will allow you to search both referring doctors, which are specific humans by specialty, as well as provider organizations that you've set up for this consult. And then you can define the reason as well. Now, there is a disclaimer here that you can only order one consult at a time. The same consult, I should clarify, the same consult. You can order multiple consults at the time if they're different. But as you see in this example, and this is a live example from where I was last week, he was actually trying to order 2 sleep studies, one to one provider and one to a different provider. And it doesn't allow that. So you would get an error that you can only order one of each at the same time. And the way around that was creating sleep study 1, sleep study 2, if that is going to be a unique need for you, where you have to order the same type of consult multiple times at the same time. Fourth tab, procedure. Now this is where we've really got a big change in the Denali upgrade. First of all, I'm just going to go through the order sheet itself with procedures. A little bit later though, we're going to get into procedure workflow, because we have in-house procedures, outside procedures, now procedures, and future procedures. And they all have a little bit of different workflows. Some of them may apply in your house, some of them may not. But overall, the procedure part of the order sheet is very similar to what we just said on consult. There is no vendor, so that pick list is disabled. There is no preferred, so that option is disabled. However, all of the procedures that are predefined in your brand new master file called procedures will pre-populate. So when you come into your order sheet on any encounter and you choose the procedure tab, all of your predefined procedures will pre-populate. And then you have the searchable options as well if you need to. This does by default give you both in-house and external procedures. The procedure details then on the right-hand side is kind of a hybrid of the ones we just looked at. When we looked at lab and radiology, we had chosen a vendor, but we had the ability of scheduling it either now or future. With consult, we couldn't schedule it, but we could choose a provider. Well, now with procedure, we can do both. We can choose a provider, but we can also schedule it. And we can either schedule it now or for the future. And that is based upon whether or not it is an in-house procedure or an external procedure, and how we have set it up in our procedure master. So with regards to that, on the right-hand side here, we see the schedule time increments just like we had on our lab and radiology. That's reading that same group type, your follow-up periods. So if you want to schedule the procedure now, maybe you're going to do a breathing treatment now, but you also want to schedule it again in a week or a month, you can do that. And within period is going to be that same group type that you've defined for your follow-ups. The procedure that you choose will have that little indicator, whether it's in-house or external. The performing provider, you have the magnifying glass, and just as we saw on our consults, is going to open up both the referring doctors for humans or organization providers for health facilities, if you define those. Now that, of course, would be for your external. If it's an in-house provider, the magnifying glass is only going to open up your internal doctors, that are part of prognosis as a licensed physician. So the filtering is logically tied to the procedure type based on how you set it up in your procedure master. Now the fifth tab is the quick view. And this again consolidates all of the other 4 tabs in one. So if you notice here, right above the blue call-out bubble that says number 5, scroll through all tests, all categories, it says page 8 of 15. If I didn't point it out, but up here on my procedures, I had page 1 of 1. On my consults, I had page 1 of 1. On my lab, I had page 1 of 1 because I was filtering them. I didn't show you my radiologies, but collectively, I have 15 pages of tests. So now when I get to my quick view, I have page 8 of 15 because it has taken all of those others and consolidated them into one. So again, this is a matter of preference as to whether you want to go to just one screen and scroll through all of them back and forth. You have all of your searchability, so you can still search by type or category. And there is a property, if you notice here at the bottom, where you can define based on user profile who gets the quick view by default. So maybe the doctor likes the quick view, but the nurses and the medical assistants do not, or vice versa. They like to go into each tab individually. So as a practice, you can set that up by user level in this property so that when you click order sheet on your encounter menu, you either get the quick sheet by default or it opens to lab separately and then you have to choose each sheet. So that's a matter of how you prefer to use it. So all of the functionality we just talked about individually under each type is all combined now under one screen. So it gives you the convenience of one screen, but the inconvenience of you now have additional things to scroll through, additional values to search through, whereas the others have built-in filters. So it's kind of 6 of one, half a dozen of another. And then on the quick view, when you are using it as you choose, on the right-hand side, all of your categories are automatically expanded to show you the details because, again, it's combining all of the types individually. So on the left, on the others, as you're doing them individually, the right-hand side is expanded type-specific. Quick view, they're all expanded. So again, it just gives you a wider area to scroll through. But functionally, it's all the same. It still shows up in that citrus color as far as what you've chosen. Each individual type, you can schedule or choose the vendor, etc. And this is the only place, if you see number 4, where your order sheet level order sets are. So that is one benefit why some doctors like to have this be their default view. Where I was last week, I'm using as my example because they're using this exclusively. Based on different types of patients that they're treating, they will order, like let's just say a diabetic patient. They have certain labs, a dietary consult, a chest x-ray, an eye exam, a foot exam that they're doing routinely every year. So they have one click where they click diabetic order set and all of those orders are done in one click. So it's a very huge convenience for them to do it that way. That's just one example as to how this option would be beneficial. All right, so that's composing the order, choosing the individual test, filtering each order type by the parameters available, clicking the icon, selecting it in the citrus color, and then verifying the details on the right. Now generating the order. I mentioned the process status, and this is primarily applicable if you're going to use the 2-person workflow. This logic already exists. This is not new to the upgrade. I'm just introducing it again for those of you that will be using the 2-person workflow. There is a property at the bottom that would need to be turned on to show the process status on your home page. So in this scenario where the doctor is going to just click the order choices that he wants and save them, and then go on to the next patient and leave the room, this home page, which of course auto refreshes every 60 seconds, will show the new status. So the nurse or the MA who's watching this home screen at the nurse's station in the back office will see, I need to go into room 3 and do the consult. I need to go into room 2 and draw labs or whatever the scenarios are. That, of course, depends on your workflows and your processes, but that's the design of it. So the process C means consult, L lab, P procedure, and so on. Now I will mention process D does exist, which means dispensable drug. Prescriptions are an external screen. The prescription screen is not part of the order sheet. However, for those of you who do the 2-person workflow, prescription can still be lumped into this workflow. It's just going to be the prescription screen is outside of the order sheet. But you may see a process D in that scenario if it is turned on in your practice. Now, in completing this process now and generating our order, we got our orders ribbon now, again, to look at the different scenarios. This is showing you the light purples, the dark purple, and the orange all at one ribbon. The light purple, again, has not been completed. It's been approved. The doctor has ordered it. So usually in your 2-person workflow, it's going to be all light purple up there when you as the MA or the nurse come in to complete it. And the single-person workflow, they're all going to be dark purple, and you're probably not going to come in here because it was all completed in one step. In either event, regardless of if it's light purple or dark purple, when you choose it, it turns orange. Orange allows you to modify it. When you choose it, and that's what we're going to look at on the next few screens. So we're going to look at our orange button. Because if you go back to our user interface that we discussed a few minutes ago, at the lower part of our screen, the left-hand side is our Select tab, where we choose our test. We have our parameters. It pre-populates with our preferred. We choose it. It becomes citrus highlighted, goes over to our right. We have 2 panels. Well, at this point now, when we choose our order ribbon, it's going to go to one. Those 2 tabs are going to disappear, and it's going to turn into one tab. So we now have an order tab when we click our orders ribbon to complete it. Up until now, we've been composing the order. So we were on the Select tab. If you notice here on my screen image, between the number 1 and the number 3 bubbles, you'll see that there's 2 tabs. Everything up until now we've been talking about was the Select tab, which was actually divided into 2 sections. Now we're on the Order tab, which is one huge window down below. And this is where we're completing the order now. So when you click the light purple, it automatically turns orange, hides the Select tab, and turns into the Order tab. And now, based on the order type, is what we're going to look at down below. So for lab and radiology, what you see is the lab or radiology order. And as our green bubble is telling you, FYI, this emulates your current workflow. So for those of you who do lab and radiology, even though the color of our screen has changed with the Denali upgrade, is basically the exact same screen you see now when you order a lab or radiology. When you click the plus sign and you choose your test, this is the same screen design that you have. So the workflow of completing a lab and radiology order at this point now is really no different than it is for you currently. You're going to print it, fax it, or e-send it based on however you process labs. Because when you click the tab on the order ribbon, it displays your order screen. Consult, it displays the requisition letter. So in your existing version, when you do consults, which is independent of the order sheet probably, you go under patient letters out and you choose your referral letter template that you've designed. Well, by default now, when you are ordering a consult and you click that consult tab, therefore, as you see here next to my number 2, the consult order has turned orange. Down below, we're looking at our consult requisition letter. Now, you may want this, instead of a letter, to be an order. That is possible. So by default, it is pulling a letter out of Letters Out, which is a standard template that you design well, we're giving you a standard template, of course, in the upgrade that, you know, basically just says, I would like to refer patient such and such to your office for, and then list the consult name. And then you can include whatever details you want, such as HPI, diagnosis, etc. And as with all of our templates, you can customize that. But if instead of a letter, you would like this to look more like an order, a lab requisition, that can be arranged through the tag design. But in any event, when you come in here to complete the order, this is what you get when you click the tab at the top. And then you're either going to print it, fax it, or e-send it, or download it to a thumb drive, whatever you do now. So basically what we've done here in the consults is embedded the letters out screen. So you will have another way now of using your faxing or your emailing capability. Now the consult tab, however, down below here has two tabs. The order sheet, you're starting to see the accordion design because everything folds and expands or collapses, either left, right, or top, bottom. So if you notice here, we click the tab on our ribbon, we get our order tab, which is our number 3. But if you look right underneath my number 3 in the middle of the screen, we have two tabs, one called consult, one called response. This is now hopefully starting to gel for you that this order sheet is a complete orders management tool. The consult is your order or the requisition letter that you're going to send with the patient. But next to it, we have the response tab, which is going to be the results. So when you start getting diagnostic results in from that doctor that you sent the patient to, you can attach those and have the results attached. And that's part of the design here of the order sheet, is everything you order can now have results. Previously, we only had that with lab and radiology. Now we also have added results to consults and procedures. So the design down here is, in addition to the order requisition or referral letter, whatever you want to call it, we're also going to have that response tab where you can attach documents. And this is just a sample of what a response might look like. You know, they could send you a letter, they could send you a scan. It all depends on the type of the type of consult that you've requested and what they're going to send you. And each one can have up to 5 attachments. So just as lab and radiology statuses go from ordered to results received, so now consults, and we'll see also procedures, will go to results received. And this gets saved to your document list as well. Same with procedure. Now generating a procedure order is going to be a little different again because we have internal and external or in-house and external procedures. But when you click on the procedure tab, it changes orange, hides the contents down below, turns it into, as you see in this example, a template. So this is the significant difference with procedures, because with consults, it's a letter out or a referral requisition. You're giving the patient a referral letter to go somewhere else and have a consultation. Well, with your procedure, it is going to be a template if you're doing it in-house. Now, if it's outside, you're referring the patient to a specialist to have something done. It's going to be a letter again, or a procedure, a referral letter, just like on the consultation. But if you're doing a procedure in-house, it's going to be a template, which is what this is an example of. Notice at the bottom here it says, see the procedure workflow for more details. This is just a sample of completing the procedure order. So now we're going to look at the other different options you will have on your procedure order. Because again, your procedures workflow may be in-house or external, now or for the future. This is for an in-house now that you're looking at. If you go ahead and order it now, it gives you the template so you can go ahead and do the procedure right now. So for comparison's sake and helping you decide, because this is new functionality, honestly, to the system. This is the one part of the order sheet that is completely brand new with this upgrade. So even those of you who have been using the existing order sheet, this has never been there. Some of you may like it. Some of you may be waiting for it and want to use it. Other of you may feel, I don't need it. It's extra steps. I want to keep doing things the way I have been. You have that luxury. So this is just kind of a guide to help you make your decision. How to complete a procedure depends upon, 1, is it in-house or external? 2, is it to be done right now during today's encounter, or are you scheduling it for some point in the future? And 3, does the provider directly create the order, or is he only composing it for then the MA or the RN to come in behind him and finish it? That goes into that single person or dual person workflow. Now, based on that, you have to decide, am I going to use the order sheet? Or if you notice at the very bottom, you still have the option of going through your table of contents specialty, which is what you do now. So for those of you that do procedures in-house, and right now you go under your encounter table of contents specialty, you use your binocular, you choose your template, and you document it. None of that has changed. So everything that I've just covered, you don't need to worry about. You still have that ability. The difference is you will not get an order number, which you never have, but that is the big change by doing it through the order sheet, because if you order a procedure through the order sheet, it now will generate an order number. It allows you to associate a pre-procedure checklist, such as pre-certification or verification of benefits or pre-op checklists or anything that you need to go along with it. And because it associates an order number with it, it can now be tracked until it gets resulted, just as with lab and radiology. Now, again, when you're doing it in-house on today's visit, usually that doesn't matter because you're documenting it immediately. You're not waiting for results. This is usually for clients. This request has come in from clients who are referring patients out. The patient's coming back now for follow-up, but the doctor doesn't know, did he or she ever have that procedure done? You know, Dr. Doolittle sent Betty Smith over to pain management to have a medial branch block. Well, now she's coming back to Dr. Doolittle for follow-up. He's never heard back from the pain specialist. Did she have the medial branch block or not? So by doing it through the order sheet now and having that order number when he ordered the medial branch block last week, he can now track it to find out if it got resulted or not. Just as with lab and radiology, he'll get notified when the results come in. So that's the reason that you might want to do it through the order sheet. So that said, if you're going to do an in-house procedure now, again, this is the same screen we saw up here. When you're doing it through the order sheet and you're going to do it now and it's in-house, it automatically creates that template on your order sheet. And that template is automatically generated in data entry mode, so you can go ahead and do it. This is no different than your existing world of going under Encounter Table of Contents Specialty, choosing your template and documenting it. It's the exact same template. It's just being displayed here in the order sheet. At the same time, it is also being automatically added under Table of Contents Specialty, with the one difference, if you notice here where my number 2 is in the middle of the screen, it is giving you an order number. And I don't have it bulleted, but if you notice where the name of the template is on the left, you cannot delete it. The delete box is grayed out because it came over from the order sheet. So we populate it under specialty. We assign the order number, and the order number is hyperlinked so you can click on it and look at the results when the results come in. That's the only difference in doing it through the order sheet as opposed to doing it directly through the specialty link. Now, an external procedure for now. Now, this is going to be very rare. The scenario that I've heard of this happening is in a multi-specialty practice that uses prognosis, where the family practice guy downstairs is ordering the patient to go up to the 5th floor and have therapy or have a pain procedure done. So even though it's in-house, it's external. So they're going to do it as an external procedure because they're not doing it themselves, but they are doing it now They're just going upstairs to a different location. So it's probably going to be rare when you do this, but it can exist. So it's designed as an external procedure template, but you're doing it now. So instead of giving you a template when you create the order, it creates the requisition or the referral letter. So when you look here at the bottom, up here, we had a template because it was in-house. This is all based on how you define your procedures in your procedure master, which we're going to look at in a minute. If it's in-house, it creates a template. If it's external, it creates an order or a requisition or a letter, or however you want to think of it, because you can format the template how you want. And then that is, you notice up above my number 4, you can print it, fax it, or email it to that other provider. It becomes just like a letters out then when it's an external procedure. Now, the confusing part is when it's an in-house procedure for the future, because it still generates that in-house template. You're just not going to document it today. You're not going to document it until the future when the patient comes back. So it's a little visually confusing at the time you're generating it because the template comes in, but when you close the encounter, all of the questions drop off because you're not going to answer them. And then when the patient comes back in the future is when you're going to actually complete the template. So in-house procedures will always generate the template at the bottom of your order sheet. External always generates the letter/requisition, whether it's now or in the future. Now, either in-house or external, you have a checklist option. This is another new feature here, a benefit of doing your procedures through the order sheet that you don't have when you do it directly through specialty on the TOC. And this checklist is a clinic form that you customize and decide that you want to link it through the procedure master as a pre-procedure checklist. Whether it's pre-op testing, insurance verification, screening questionnaires, whatever has relevance in your world. And it can be right there in the order sheet along with your procedure. You link it through the procedure master setup. And then just as we saw in our consults tab, you have an attachment tab for results. So when that procedure, especially external, has been accomplished and you're getting results now, you can attach up to 5 attachments. The status will change to results received. All right, so that completes the order sheet. I know that was a lot. Broken down collectively, when you start using it, hopefully it will all make sense. It is a nice tool as far as having all of your orders in one combined screen. It does have setup involved. So if we look here under our settings configuration, there's some master files involved. Our consult master, you assign the name of your consultation. You define it as male only or female only, as with all of our templates. That way it only comes up based on the patient's gender under patient register. The specialty that you define is going to filter the doctors that are available for you to associate as the preferred doctor. That preferred doctor lookup when you click the binocular. So if you see here at my number 3, I put specialty dietitian, preferred doctor Christine Mia Baranski. When I clicked my binocular to choose Christine Mia Baranski, it filtered to my humans and referring doctors with the specialty of dietitian only. It filtered to my organization providers. Now, organization providers do not have specialty, so it will be all of your organizations. So if you put in their different health centers or whatnot, they all come up combined in the search screen with your human referring doctors, but the humans are specific to the specialty you define. Some people have chosen that are already using the upgraded version here. For specialty, they're just putting consult and then assigning that to whatever entities they want. So that's your choice. It doesn't have to be a specific specialty. But for those of you that are already using your referring doctor master and you do want it filtered accordingly, that's a nice filter to use. The letter template then is coming to you. When you get your upgrade, it's going to look just like this, default order template. there is a template coming with your Denali upgrade called default order. You can modify it as you want if you don't like the default once you get the upgrade. Procedure master. We have both in-house and external procedures. Now it's one master file, but if you notice next to my number 3, you're going to designate whether it's an in-house procedure or an external procedure. And the choices are, the required choices vary based on which radio button you've chosen. So this screenshot shows you in-house. Just as with consults, you can make them gender specific. You can assign a procedure checklist. You have a procedural template. So that procedure checklist, the binocular is going to open up clinic forms that have been designated as a procedure checklist clinic form. Procedural template. These are your specialty templates that have been designated as a procedure template. We'll get to that a little bit later here. There's a new indicator. It's not really a new indicator, but an indicator that you may or may not be aware of. When you create a specialty template, it can be designated as a procedure or not. This, during upgrade, important disclaimer, when you get your Denali upgrade, every template that you have in your database under specialty that is identified as procedure will automatically create as an in-house procedure in this master file. So by default, none of you will have an empty in-house procedure master unless you have no in-house specialty procedure templates currently defined. And then you can also associate an order template here. And an order template, again, will default to that default order, just as our consults will, default order template. Now for external, you don't have the template option. You can still assign a procedure checklist, but you can assign a letter because you're referring the patient out to an outside source. So you can assign a referral letter, but you do not have an option of choosing a procedure template. That is for in-house only. So it is based on this design here that when you choose an in-house template and you complete the order and that light purple tab turns orange, you get the data entry template down below because you're assigning the template here. Whereas here on external, you don't have a template, you have a letter. So when you generate a letter or when you generate the outside procedure, you're getting a letter or referral requisition order, not a template. The last master file is your order sheet order set. So we discussed earlier that you have the option of doing it ad hoc as you go when you create an order under the Quick View tab, but you also can create it here. So here's the example of the annual diabetic review. You just designate your order set type as order sheet. And therefore, if you see outlined in my blue rectangle, it can include lab, radiology, consult, and procedures. All right, some other order-related features. CPOE menu tab has been modified to now include new options for consult and procedure. So at a system level, if you want to verify your consult and your procedures and are they still outstanding or have you got results, you want to know, did Miss Betty Boop get her medial branch block that you referred her for last week? You can go under your consult search. Just as with lab and radiology, you have your different status choices. A is approved, O is ordered, R results received, C reviewed and completed. And it shows you here in parentheses what is going to get opened when you choose that record out of the search screen. If it is approved or ordered, when you choose it, you get the consult tab because that gives you the order details or the requisition. When it's results received or reviewed and completed, you get the response tab so you can look at the result or the attachment. So in the case of the ordered, it opens your consult tab where you can see the letter, the referral order, results received, you get the response. Same thing under procedure. You got the same options available and it's just a matter of if you're going to get the procedure tab template or if you're going to get the requisition. And that, of course, is based on whether it was an internal or an external. Order sheet orders are now tracked in health maintenance. So we talked about that health maintenance option available on the order sheet. It is bidirectional. So back on the health maintenance on the face sheet, when it was coming from the order sheet, it will be hyperlinked, as you see here, so that you can look at the order on the order sheet from the face sheet. There are new document types that you will now see on your document list to accommodate these changes. Consult order, procedure order is in the interim state when the order through the order sheet has not yet been resulted. Once the result comes in, it will show as a consult response or a procedure result. So those are 4 new types you will see on your document list, if you use the order sheet, of course. All right, now that's completely done with the whole orders management piece. Now just getting back to general Denali upgrade features. Assessment scrubber checks. For those of you who use our billing module, you're familiar with what scrubbers are. We've added them now into the EMR level on the assessment screen. So even if you don't use billing, you can take benefit of these. But basically, a scrubber check is a validation that you can customize. If something is present and something else should be or should not be, and you don't want that claim to be closed or a claim to be created because it's erroneous data, you can create this error to accommodate that. For instance, in this example, you cannot bill for both a new patient and an established patient level of service on the same date of service. It's one or the other. So instead of letting the encounter get closed and the claim get created, the scrubber check is going to warn you so that you have to choose one or the other. Is it new or is it established? So there's a property that governs this feature that can be turned on or off if you want to use it. And then there's a new master file where you build these scrubbers. And again, for those of you who are used to it on the billing side, there's no difference. It's the same user interface. You go into the setup button, you define whether it's a warning, meaning it's just an alert that you have the ability of overwriting, or you indicate whether it's an error where you must actually fix something before it will let you go past it. And it has operands, operators, and values. So the operand you're going to choose is the piece of data that the CPT code, the diagnosis, the insurance, etc. The operator is basically the mathematical equation or activity you want to perform. Is it equal? Is it greater than? Does it compare to? And then the value is the data that you want to be included in that equation. So you're basically building an algebraic expression here with the data on your assessment screen. So you can compare diagnoses and CPTs and HCPCS based on the doctor, based on the insurance, and whatever other condition you may need to accommodate. And as with all things, if you don't know how to do it on your own or need some assistance, technical support can help you. They're also available on the doctor forms. So if you use doctor forms in your practice, not only can you have these on your assessment screen, but you can also have them on your doctor forms. Encounter screen level upgrades. The labeling has been modified just to bring it into consistency on the edit existing and start new encounter screen. That's just a label change again. It's not really any logical change. Term provider instead of doctor. Same thing on the edit existing encounter. It's been resequenced also so that they match. Again, for hand-eye coordination when you go from one screen to the other. Table of content menu changes. On your table of content menu, which is on your encounter screen, if you notice here on the left-hand side in blue, we now have single options called lab and radiology, whereas on the right-hand side now, outlined in pink, you have 2 separate options, lab order, lab result, radiology order, radiology result. They've been condensed now into singular options with submenus. Currently, your result option is a submenu where you can choose result or matrix. So as you see above, we now have a single option with a submenu that you choose order, result, or matrix. And then we also have a new option called procedure order. Procedure order is for procedures that are part of the order sheet but done independently of the order sheet. Sort of like now in your world, if you do lab and radiology outside, let me rephrase that. A patient comes to you now with lab results or radiology results that you did not order, and you're discussing them, maybe to give a second opinion, and you're including it in today's visit. So you enter those results into prognosis even though you never ordered them. That's what this is on a procedural basis. It's letting you create procedure results even though you didn't actually do it necessarily. So it's like an outside procedure. So this is not the same as your specialty. And I just want to give a disclaimer here. I probably need to add it to my PowerPoint actually. Some of you, based on your specialty, the word specialty may actually say procedure. I know a lot of our pain management doctors, for instance, when they implement, they have us change their word specialty on their table of content to the word procedure. This is not to be confused with that, because specialty is still specialty, which varies from one clinic to another based on your specialty. It may say family practice or pain management or procedure, gynecology, whatever your specialty is. Generically out of the box, it is usually just specialty. Sometimes a doctor will change it. So if you are one that currently has an option on your menu called procedure, this new option, procedure order, is not replacing it. This is a brand new feature for the ability of creating a new procedure directly with a result outside of the order sheet user interface. So it's not the same as doing a procedure through the specialty option. On your face sheet, there's now the ability of having notes under health maintenance. This is health maintenance specific, not test specific. So meaning patient level. Just as all of your other face sheet squares have notes, until now health maintenance did not. So we've just brought that into consistency now with your other face sheet squares. There is a history level notes now with phrases that you can predefine. Vaccination module has some new tags that have been added to differentiate from recommended vaccines and required vaccines. So if that is something that is applicable in your practice, you can now have those different differentiations in your shot records. This specific change actually came out a little bit ago in version 3 and a patch. So this isn't necessarily brand new to the Denali upgrade, but we are introducing it in case some of you weren't aware, or you probably have seen it by now if you are on the current version. But the buttons and icons have been changed under your HPI and specialty screens. So if you used to be used to that button that said copy and those grid buttons in the middle that said number 1, number 2, number 3, they've been repositioned and right aligned. So the functionality hasn't changed. It's just been graphically changed aesthetically. And the H button is there to access the face sheet. That was something that was new. Document list submenu, we've added those 2 new types, consult and procedure, to accommodate the new document types. Also on your document list, we've added pagination. So you can now have up to 25 documents per page, and then there's going to be a hyperlink display there. So if you notice they're outlined in yellow in the middle of your document viewing area, each number will represent 25 documents. This is to improve efficiency and screen loading time, as well as in navigating from one record to another. Some patients that you've seen for years have hundreds and hundreds of documents attached. And so that, of course, affects screen load time. and record navigation from one patient to another. So this greatly improves that kind of efficiency. There's also a new icon added that is based on a new user role that you see at the bottom. So those of you who use portals, this is with regards to patient portal, referring doctor portal, and the brand new employer portal, which is new to the Denali upgrade. You have the ability now of sharing documents from the document list on those various portals. So if that is something you need in your practice, this is an individual user permission that you can give to whomever in your office needs it. The icon will be there for everybody. It'll just either be grayed out or available based on this user role. And then if it is available because you have the user role, and if the document is applicable for sharing, then you will have the ability of turning that document sharing status on or off for each individual portal. Now this, of course, would require you to have the portal in your practice. If the document is not available for sharing, it will give you an error not applicable for sharing. And then because of this, there's a new column added to your document list to indicate when a document has been shared. So they'll have little icons there, a P for patient portal, R for referring doctor portal, and E for the new employer portal. And it will be gray and white when not shared, blue and yellow when shared. You also can filter accordingly. So if you want to look at only documents that have been shared on one or more of those portals, we've added that into the filtering. And this is an appendix that tells you the conditions as to if a document can be shared or not and when it is not applicable. For instance, op notes and procedure progress notes, you will get this not applicable error if the encounter is open. But once the encounter is closed, it will be shareable. So there are sometimes conditions like that. And lab results, if you have not got them, if you have it marked to where they can only be shared when the doctor's reviewed them. If the doctor hasn't reviewed them yet, it will not be applicable for sharing until the doctor has reviewed them. Or if the doctor has marked it as hide during his review, it will be said not applicable for sharing. So there are conditions associated with whether or not you'll be able to share it. Charge validation. Now this is kind of a crossover for billing users. So this is also included in our billing webinars if you use both systems. But this is part of the EMR setup for those that are subject to the government, non-government crossover where based on payer, a specific CPT or HCPCS code needs to be different. Previously, up until now, it was based on an encounter type indicator. That still exists as a default logic, but we've added the hierarchy of a claim filing code. So when a patient does have default insurance, the claim filing code is what will determine whether it's the government or the non-government code that drops on the bill. If it is self-pay or an obscure insurance that doesn't have a claim filing indicator, then it will still look at the encounter type indicator to make that determination. There is a new autocopy assessment. I'm sorry, a new autocopy property. Autocopy functionality that has been expanded to the specialty level and removed as a system-wide property. Autocopy assessment data previously was system-wide. So for multi-specialty doctors, it posed a bit of an issue if you wanted the diagnosis to autocopy forward. So now it is at a specialty level. So for those of you who do have multiple specialties in your practice, you can now utilize the autocopy functionality if you so desire. So previous property is now obsolete, and it has been located into the specialty master. There's also logic now for autocopying the prescription details from the last encounter. This does not apply to zero duration deleted or reopened encounters. So only previous encounters that had a duration that is closed and was not deleted is subject to the valid details copying forward. It will auto-copy the prescription details on the open of a non-zero duration encounter, meaning not on encounter start. If the immediately previous encounter has no prescription, this property will look through the encounter history and pull from the most recent last encounter that does have a prescription. Now, this is a very specific scenario, so it is based on the property that you see at the bottom. It's the same client I happened to train last week that needed this functionality. So it may not be something you need, because we have a lot of logic already in place at the prescription level that auto copies from the pharmacy, from the patient, from the doctor. But this is in a scenario where you see the same patient every 3 months for quarterly refills. And every 3 months he's getting the same 20 prescriptions refilled. And you don't want to rekey those same 20 prescriptions every 3 months. That is what this logic exists for. All existing prescription logic still applies. So by default, this property, this new property, will be set to no. But if it is something you would like, you can turn it on. Along the same lines, we do have a new property for autosave. This also is part of the billing webinar, so you may have already heard it if you attended a billing session. Autosave, currently, it is a single property that was yes or no. That property has now been obsolete and replaced with a rule that instead of yes or no, you define whether you want to be prompted to confirm changes, whether you want to ignore your changes, or if you don't want to be prompted but you want everything you make to autosave. This is outside of your user workflow. So if you use your green workflow arrows, that already autosaves and always has. So what this is doing is taking that workflow logic and extrapolating it outside of the workflow. So you get the same benefit now when you're navigating from screens that are not sequenced without being annoyingly prompted every time, do you want to save your data? That's what this is doing. ERX summary now displays all errors in one window. Previously, if you were e-prescribing and there were different errors, you would get them one at a time. So it could be a little annoying trying to save them or update them individually. So now if a patient, let's say they're missing their date of birth, their address, and their zip code or their gender or whatever is not matching SureScript, you'll get all those errors at one time so you can fix it all at once. Two new lines have been added into the encounter close summary to accommodate consults and procedures. So if those, again, are outstanding, you will not be able to close your encounter. This falls in line with that two-person workflow process status, that if that process property is turned on as a failure to close your encounters until the message has been, until the order has been completed, you will not be able to close your encounter. Other upgrade features, letters out. There are now 47 recipient choices in the 2 that will default. So in the upper left, patient level details now include case management, employer, as well as all the other types of details that have previously been there. Now that of course requires that they be associated under patient register. But at least if they're there, you can now automatically correspond to them through letters out. The UI on your clinic form screen has been tweaked a little bit aesthetically to bring in some consistency. For instance, to change your name, we now have the binocular instead of the hyperlink. Previously, if you notice down here in the lower right outlined in pink, the word name was a hyperlink. But usually in our system where you do a name search, there's a binocular. So we've made that change so that it's consistent behavior. Also, we've added the umbrella for patient insurance. So when you're on the clinic form and you need to do anything with patient insurance, you have that ability. The user interface for your tabular reports has been modified. This again is repetitive from the billing session. If you attended it, this is a very nice feature for those of you who use reports. It's been streamlined from having to do it in 3 separate windows and then have to restart it when you wanted to regenerate under new data. You have a single screen now where you can enter the parameters, select the query you want. If you want to refresh the data or modify the parameters, you can do it all on the same screen without having to back out and research for the report again. It all happens in one window. Same thing with graphs. Now, graphs aren't as prevalent in EMR as they are in billing, but the functionality is there. So if you are one that uses the graphs in EMR, the same user interface has been applied so that you can refresh the data all in one window. And the old UI, again, required separate windows to toggle between. We've also added the classification, which makes it easier in identifying and filtering. And the output has been enhanced. You can toggle between the different graph types, and under the graph master, you can choose whether you want it to be a bar graph. You can decide the colors you want, the labels you want for your XY axis and things like that, whether you want it to be a pie chart. All of this, again, I'm kind of skimming through this because we're running out of time, and this was also covered in the billing webinar where graphs are more prevalent. But it has been expanded into EMR also. Settings configuration nomenclature, because of the change that we made on the front screen with regards to nurse now being clinical staff. We've also made changes under configuration that caused confusion for people. The term medics has now been changed to users because medics implies it was doctors, and it really isn't. It's users. So previously, wherever you saw the word medics defaulting, it meant users, so now it will say users. Also, what previously was called admin staff is now going to show as office staff. That was a little ambiguous because a lot of folks, especially in the IT world, thought it meant administrative, and it really didn't. I mean administrator, and it really didn't. It meant administrative, clerical, or office. It does not mean you have administrator rights. It meant you had clerical rights. So that label has been corrected to say office staff now. No logical changes. These are just label changes in the nomenclature. I mentioned the 2 new organization masters. The organization provider has relevance with the consult master. The referring organization is more relevant in the billing side, but it's defined also up in front in EMR. These are for organizations, not humans. In the specialty template design, these again are label changes only to minimize confusion. What used to be called face sheet is now called carry forward. What used to be mandatory is now default. Logically, it's all the same behavior. The label changes now reflect that behavior. Copy sys. Now this is a beautiful feature. I personally have been waiting for this function. If you do template design, you'll appreciate it. There's a new icon here that allows you to duplicate at a system level. Now if you don't do template design, you may not be too excited about this, but the benefit here is, let's say you're dealing with, as in this example, extremities. Anything that's left, right, bilateral, normal, abnormal, adult, child, where you need a large number of questions to be duplicated, but just streamlined to a different, from left to right, for instance. Instead of having to manually create 25 left questions again to make them right, you can duplicate them all at once and make them right. So we've added that ability here on the system level. Now this, of course, is in template design. So only those of you who do template design does this impact. But it is a very nice feature in being able to duplicate a large number of elements at one time. and it will just simply ask you what you want that new system to be, and then confirm that you have now duplicated 20 questions from the left into the right. Clinic form configuration. There is a new checkbox for procedure checklist. So when you're creating a clinic form, if you want it to be deemed as a procedure checklist on your order form or on your order sheet, then you click this checkbox as procedure checklist, and it will be available in your procedure master to associate it as a checklist for your procedure. Importing tests from an LXS. So again, for system administrators who are working on template design, if you've got a lot of questions or elements that you need imported and you've put them into an Excel spreadsheet instead of creating them manually one by one, you can now import those. Copy role. There is a save as now. This is important again if you're needing to create super user roles and then just make tweaks. You don't have to recreate every permission from scratch. Admin properties. Those of you who have administrative rights and you do go in and tweak properties once in a while, the user interface is greatly enhanced now and much more user-friendly. You've got pick lists and multiple choices and color selectors, on-off switches. Previously, you almost had to be a programmer, so this has become a lot more user-friendly. And most importantly, supported events is now under user login profiles. Supported events is a property, especially for doctors and nurses, that will clutter up your mailbox with system-generated alerts and notifications based on transactions that occur. New patient referred, drug has been prescribed, letter has been attached, different things. Doctors will sometimes get hundreds of alerts every day in their prognosis inbox that they really don't need to be bothered by. You can shut off those alerts if you don't need them. Previously, this was not available to users, so you had to go through technical support to manage. Now you can manage it on your own. So if you go under admin properties, supported events, you have access through the binocular. You can now turn on or off the alerts that you want. And this is just a couple of examples as to the alerts or notifications that are triggered. Miscellaneous items then. Internet Explorer users. If you're going to use Denali and you still use Internet Explorer, remember you have to have compatibility view turned off. CPT HCPCS for state-provided vaccines will no longer auto-populate to the assessment. Drug info sheet preview is now in PDF instead of HTML. Decimal point calculations. If this was an issue for some of you, where your decimal points for like lab results were being cut off at 2 decimal points and it really was 4 or 5 or 6 digits out, they will now be retained all the way out to how they come in through the interface. There is a new clinic ID tag for displaying your clinic ID and output templates where needed. The ability to delete CPT HCPCS from master file is now conditional, so there are validations if users try to delete them. Sequence indicator has been added to your complaints master so you can sequence those. That's when you're under HPI and you're choosing your chief complaint. You can sequence those so your most frequently used are on the top. Color selector tool has been made available throughout wherever colors are to make it easier in choosing the color. And then we have our good old repetition in every webinar. After the upgrade, there are first-time user experience bubbles for all of the new features. These yellow tooltips are available to explain the new feature in a sentence or two. Once we start having videos, there will be a third hyperlink in here to play that video. Right now, there are no videos ready for these new features, so your only choices are to hide the pop-up, which is for that session only, and it will reappear the next time you log in, or don't show me again, which means you will never see it again. Once the upgrade's applied, you have the new bubble that gives you release notes for up to 30 to 45 days. The abbreviated details provided here are expanded on. My webinar here is about 120 slides. Detailed release notes are about 250 pages. So if you want additional detail, feel free to read those release notes. And of course, we have the Resource Center, where eventually here we will start having more videos posted momentarily. And as always, we do ask for your feedback. If you do want certain content included in videos, please email us at the training email to let us know what you want. Alrighty, that is the extent of today's session. Are there any questions for those of you who have remained?
Can we get a copy of the slides you showed today emailed to us?
It's actually on the Resource Center to download.
Okay, perfect.
Under User Guides, you'll find it under the EMR section.
Okay. That would be helpful.
All righty.
Thanks.
Certainly. Any other questions? All right. Well, you all have a pleasant week. What's left of it. Thank you.
Thank you.